And welcome back. Well, anyone who has pain knows that it can sideline you from your daily activities, including work. But our next guests have a great story to tell you about a solution that lets you get your life back with a much quicker recovery time. Joining us now is Dr. Richard Berger with one of his very happy patients. It's Coach Jim Voutiridis, and his players call him Coach Voot. Thanks for being here, you guys.
Good morning. Thanks for having us.
Good morning.
Good morning.
I want to start with you, Dr. Berger, and I want to talk a little bit about this procedure because you have a background in engineering from MIT, correct? And you created this new surgery that really cuts less tissue, giving a quicker recovery time. So explain how it works and a little bit of your process.
Sure. I got a degree in mechanical engineering from MIT, and that allowed me to really look at surgery in a very different way, trying to do it without cutting the muscles, ligaments, and tendons. And it turns out that's what hurts. So I developed a way of doing a hip replacement and a knee replacement, doing minimally invasive surgery. That's without cutting the muscles, ligaments, and tendons. Patients simply got better faster with less pain. And then we took that the next step further and actually started doing outpatient hip and knee replacement, where patients went home the day of surgery. And in fact, we're back driving and back to work as soon as a few days or a week. And we continue to improve that. We've been doing that for a number of years now. And now we kind of married that together with modern medicine. And now we do telemedicine. We developed this BEST experience, which stands for the Berger Elective Surgical and Telemedicine Experience, where we do a lot of our visits virtually and just make things easier and faster for our patients.
Well, I love that you brought that up, doctor, because I think, what is it, like 50% of your patients are from outside of the Chicago area. And since we know you're at Rush in Chicago, this allows people to have access to you when otherwise they would have to pay for lodging, travel, for some of these other, experiences that can be telehealth and outpatient. So talk a little bit about what that BEST experience gives to people.
Sure. About half of our patients take an airplane to come see me from all over the country. In fact, all over the world. I've operated on patients from every continent except Antarctica. So patients have now the ability, if they want to see us virtually. So they can make an appointment to see us. We'll diagnose them. If they need physical therapy or just medications, they don't need to come and see us. We can arrange that where they are. But if they do need surgery, they can come to Rush, and we schedule that on our telemedicine call. And they can come in the day before and meet me, or come in the morning of surgery and meet me, have the surgery, and then spend a day or two in Chicago if they'd like, and then fly back to wherever they want to. And that just makes things easier for our patients. We used to only do this with our rich and famous patients, but now we do this with everyone, whether or not you live locally or whether or not you live far away. If you just want to do a telemedicine health appointment with us, we can do that with you. It just makes things easier for our patients. And that's what we're trying to do. Make things easier for our patients. Some patients want to do it everything via telehealth. Some people want to come in and do everything in person, and some people want to do a hybrid. So we accommodate them to make this an easy experience for everyone.
I love that accessibility, doctor. And speaking of that, it worked for you, right? Coach Jim, I want to bring you into the conversation. Coach Voot, you had 2 hip surgeries. So is it true? Tell us a little bit about this. You were basically sidelined from coaching due to these hip issues that you had, weren't able to do it, we're going to retire. Then you had 2 hip surgeries in 2022 from Dr. Berger?
Yeah, that's correct. So I had them both done this spring. One we did in February, and then we waited the 6 weeks to come back in April. I was contacted by our head coach just after going through the process, and he kind of said, "Hey, do you think you want to come back?" And I said, "We'll see." Well, after the second surgery, there was no doubt I was going to be able to come back. Prior to this, I had to drive to our practice field. I was in that much pain. And now I have no issues whatsoever. I can walk to practice. I can stand at practice for 3 hours. I can actively coach. And it all comes back to Dr. Berger and what his group was able to do for me.
I mean, that's incredible. I mean, really, that's a great testimony. And I know it was like 10 days before you were doing physical activity again, which is like unheard of. You even surprised the doctor. But you used that BEST approach and some of the telehealth to be able to do these, meetings and doctor appointments. So talk a little bit about that experience, because I think sometimes people are nervous after a surgery to not be in person. So how was it for you?
The telehealth was great. It gave you the ability, without having to travel, to talk to the doctor, not putting your body through sitting in the car or any of those other things that you would normally have to do to keep your appointments. You didn't have to do that. It was as simple as a call, as a Zoom meeting like we're doing right now. And it really gave you that reassurance that you need on a regular basis. When you come out of surgery or something happens and you feel like you tweaked this or that, having access to the staff and to Dr. Berger via telehealth really puts your mind at ease and makes the recovery process much better because you're not worried about little things that you can get cleaned up.
Yeah, and Coach, I know people know you here. You're in the Milwaukee area for being based. Like, I got to confirm this. Is it true that you've recently played like 3 rounds of 18-hole golf?
Yeah, I played 3 rounds of golf in 4 days, which I haven't been able to do in 20 years. I wasn't sore. I wasn't tired. And trust me, those of you that play golf out there, I take plenty of swings. So it's the real deal.
You're not a one-hole wonder.
No.
You're like, I got the other coaching down. Golf is always a practice sport. Dr. Berger, we're out of time, but I just got to say, I think it's incredible what you're doing. I'm going to give all the information for people to see you, but I'm sure your last message would just be, hey, come see me, make an appointment, right?
Come see me, make an appointment. Don't live in your pain. Take Coach's word for it. It's easy, it's quick. We've been innovating for years. This is our latest innovation. We're just trying to make this easy and accessible to everyone, so take advantage of it.
I love it. Dr. Berger and Coach Voot, thanks for joining me today.
Thank you.
Thank you, guys.
Absolutely. For more information on that Best Experience program or to book an appointment with Dr. Richard Berger, just call 312-432-2557, or you can visit outpatienthipandknee.com. Dr. Berger performs his surgeries at North Shore Surgical Suites in Pleasant Prairie as well.